GERO 200, how you doing? So it is Sunday, August 2nd, 2022. And yes, we are Saints fans in this household. Julia, my wife and co-instructor, okay, grew up in the suburbs outside New Orleans and in Metairie, Louisiana. And sadly, with no time left in the clock, Will Lutz kicked a 61-yard field goal. They were playing in London for the football fans out there, and it ping-ponged off the uprights twice. It didn't go through. So we were a little saddened by that, okay? So it was appropriate for me to be a little bit depressed. Hey, we're going to be talking about that today, all right? All right, so just to give you the, a heads up, we are pretty much done with this grading and critical thinking assignments. Way to go. You guys showed true abilities to do data capturing, okay? So you acquire the data and then data analytics, and that's awesome, okay? That is your jobs. That is your life in the future. Be sure and calendar this, okay? So 2 weeks away, you can choose any time within this week span here, going from October 6th, Sunday, October 16th to Sunday, October 23rd. Once you get going, you have 2 hours, okay? And unless you have OSAS accommodations, and then we modify that time frame for you, okay? It is basically a repeat of the quizzes, but do remember we're drawing from pools, okay? We'll send out a little study guide to help you with that, so no worries, all right? Let's pop right into week 7, okay? We'll go right in here. Awesome, okay? All righty, so we basically are really setting you guys up for the, kind of the economic, the financial, but also the personal toll that aging and age-related disease can take, okay? There are some great aspects of living longer and being healthier, okay? But we've also exposed you some of the big ticket items that have kind of a crippling effect on you personally, on the person experiencing it, so you may be doing the caregiving, etc. And then you just expand outward to some of the issues at community and state and federal level in terms of financing the support that people need as they get older, okay? Alrighty, so we saw that in here, and this is not only just healthcare. We've heard about these chronic diseases of aging, okay? They're not infectious, they're not communicable. These are the non-communicable diseases of aging, and how, it is a burden for that person and for you financially, emotionally, okay? It all takes time. And we're going to talk today about mental health issues, but they're very connected to everything else we've done up to this point in time, okay? We set it up with, some of the aspects of aging and maybe some of the things we can do to reduce the likelihood of getting these diseases we've talked about. So we've heard like the one that is our favorite, of course, is we didn't want to get cancer by having overnutrition, okay? So that way we don't have those growth factors. We heard about that IGF-1 story when we did the theories of aging, okay? And then the other thing we do is by eating right, okay, not overeating, eating our fruits and veggies, exercising, reducing our stress, meditating, whatever you got to do, you reduce the ongoing damage that happens in your body. The speed. You're not going to get rid of it all the time. I certainly don't feel anything like I did when I was 50, okay? but by having the appropriate outside environmental influences of diet, nutrition, and stress reduction, then I'm not going to get that free radical damage that we heard about, okay? The oxidation, all right? So I'm generating more protective mechanisms within my body by living the right way, and then it's going to protect me from having some of these diseases. I'm still going to get old, okay? I'm still going to have a period of significant decline, but I'm not going to be this 30-year long burden. That's my goal. All right. So that we talked about again this with respect to cancers. We also, both cancer and diabetes, related this to, you have genetic predispositions. So if you have a history in your family, you got to be extra careful with those outside environmental, okay, nurturing variables of diet, exercise, and stress reduction, okay? Because diabetes affects every blood vessel that goes to your body. We heard about all those diabetes associated complications. People go blind, they have a loss of kidney function, they have a loss of adequate blood flow to the lower limbs and have amputations, they get heart attacks, they have strokes, okay? And then the new one we're going to talk about today, yes, Alzheimer's disease is a vascular disease, okay? And so people that have diabetes are at super high risk for getting Alzheimer's disease. 80% of Alzheimer's patients, 80, suffer from some form of diabetes. So it's a big risk factor, and like I said, there's so much of it is a modifiable risk, meaning, if we could just, have people wrap their head around eating better and exercising and, trying to reduce their stress. I know these are not easy, but if you could do that over a life course, then you're going to dramatically reduce your risk for Alzheimer's disease. All right. There's a couple of unique inherited versions. They make up 2% of the cases. So they're not a big issue. Big issue if you inherit it, but for the other ones, it's all kind of modifiable. We'll get into that as well. All righty, cool. All right. So and then so we've set it all up here, and we'll be talking next week, and we tap into it a little bit this week in the discussion. When somebody has cancer, diabetes, vascular disease, it has all the diabetes related complications, and now Alzheimer's disease, the help lies on either your shoulders directly, okay, as a caregiver, or financially by hiring somebody else to do it for you. But either way, there's a cost, okay? And so that's what we're gonna be getting into. Now, with respect to Alzheimer's disease, and I wish we could have done Parkinson's, but we don't have time. But these diseases are extremely debilitating, and they have an on average course of about 10 years. So 10 years of significant caregiving issues that you're going to have to shoulder and figure out what to do. All right, so it's a big deal, and this is why we got to come up with some better kind of policy, whether it's local, state, or federal, to help people out, because people are living longer, so this is becoming a bigger and bigger issue, and has economic implications. All right, so we'll get into that later. All right, so let's get into mental health. This video, of course, is going to go right here. Again, always as we're doing these assignments, what I encourage you to do, I'm going to scroll all the way down here, and I'm going to get to that information. Open the quiz up in a separate window, okay? And that way you can go back and forth as you're doing this. This time we are relating the discussion to what we're doing up here, okay? We kind of hit you over the head with the financial consequences, okay, in terms of the personal and the kind of national costs that we have for our country in terms of billions and billions of dollars, okay? And so you kind of read through that, okay? And then you look at the personal cost right here to you as a caregiver that we were talking about. Here's some issues right here. So this illustrates a little news piece about caregiving. This right here is to show you what it's like to be around both this video and this video, somebody who has pretty significant dementia and why they need so much care. And then we want you guys to dive in there and take care of this. Now, if you, as an aside, find yourself live in the Los Angeles area, but these caregiver resource centers exist. We have one down here in South Orange County, the University of California, Irvine operates. But if you need help and you're like, I have my own children, I have to work, and now I'm racing around trying to help my older grandparent or parent who's now suffering for dementia. This is an amazing center right here we have. If you live in the LA area, this is the USC Leonard Davis School of Gerontology Family Caregiver Support Center. So we give you direction. We have caseworkers, okay? So no matter where you live, seek help. You don't have to do it alone, all right? Awesome. Okay, so I'm gonna go all the way back here, okay? So the way we played this out, we have kind of two reading assignments, and then we'll go over the videos down here and the figures. We'll make it all one big package, all right? So hopefully you guys watch this video. Whoever's looking at it, hey, you're watching it, okay? Let's begin with a very short, it seems like it's long when we get in there, but it's a PDF file we had to make. The American Psychological Association, it's a review on aging and mental health status in the United States. They sadly they took it out of their website. This happens oftentimes. They repurpose their website, and but we love this article because it really sets up the framework, okay, of some of the issues. So we kept it as a PDF file. So this, you can't get it to the as a website. You get it as a PDF file. And then I'll talk to you about this right here. If you're an aficionado, the quiz questions are not on this. The midterm is not on this. But if you need more information about psychological health, maybe you wanted to maybe pursue this as a future career, check this out right here. But first, let's begin with this guy right here. So I've already downloaded the article. So what I'm going to do is rather than click on it, I'm just going to look at my download and I'm just going to go right into it here. Okay, my friends. Okay, so it says it's 11 pages, but you'll see it's not. It's actually not really 11 pages. Okay, so we're looking at the again, as people live longer. Okay, we're looking at the growing mental health and behavioral health concerns facing older Americans, and they really kind of dive into. We're going to talk about the population based, okay, the demographics, okay, the age structure. These are all different ways of saying, who gets clinically depressed, okay? And we can look at it from, from the 0 to 10 years of age all the way from 90 to 100 years of age and ask, so are you more likely when you get older? Let's get into that, okay? But certainly you're more likely to have these outside non-genetic influences, okay? These would be environmental influences. This is kind of the nurture versus the nature. Nature is if you genetically have a predisposition to having mental health disorders, clinical depression being the biggest one, all right? So yes, as you get older, things like a loss of a spouse, loss of mobility, your loss of your independence, okay? Declining physical health and just your overall mental health are triggers, okay? Environmental triggers to cause depression. You begin to think about it, okay? And it seems bizarre, but as you sit there and you have lots of anxiety and you begin to what's called ruminate, where you just kind of think over and over about how sad my life is, how hard my life is. There's a rewiring of the brain, okay? So then these triggers are more likely to get you deeper and deeper into being depressed, and then you release hormones in your body that further it. So it becomes kind of a downward spiral. Okay, so that's what they're talking about here. Okay, and so they reiterate this right here. Okay, and the fact that we really need to treat mental health and behavioral problems. Okay, because it will help. When you have clinical depression, you're so much more likely to get diabetes, so much more, so again, which is the horse, the cart? Actually, clinical depression can cause diabetes, okay? More likely to have cardiovascular disease, and then depression can be a risk factor if you have unrelenting depression that you don't treat it for getting different forms of dementia. Now, I can reflect on this, okay? It's it's old, it's colloquial, again, aging's not for sissies, and I understand the decline in both mental health, okay? So my speed, my cognitive quickness, okay, and then my physical health. Okay, we see here physical and sometimes mental health. Okay, so so for me, okay, being an athlete my whole life, and then blowing my knee out. I destroyed my knee in my 20s, made it work. I had no range of motion, 40 degrees range of motion maybe, and then I was 61 and I didn't actually have any ligaments. I had a bone hinge and it snapped. Okay, my leg went out sideways and I had to have a total knee replacement. Up to that point in time, felt like I was surfing as good as you could imagine. I mean, I was doing really well. Surfing big waves, not surfing kiddie waves, and then suddenly it was a wake-up call. And then I made my comeback after my total knee replacement, and so I was 62, okay, and for 3-4 months things were going great, and then I tore out different segments of both my shoulders because I actually came back too quickly, okay. Should have slowly built my shoulders up too, okay? So I had shoulder surgery on one, rehab the other. I never fully came back. So that was when I was 63. I'm 66 now, and it's I'm doing okay, but I never really came back. And up here it's not very satisfying, to know where you were and where you're at now. So that's the kind of thing you have to work with, okay? And then what did I do 6 weeks ago? I tore my hamstring surfing. So it's not easy because it keeps me from doing what I want to do. I want to surf. It keeps my mental health in a good place, okay? It is my drug of choice, so to speak, okay? It's where I meditate. All right, so we're going to look at stats later on, okay? 20% of the people over the age of 55 suffer from some form of mental disorder. And we see that we look at nursing home residents, 2/3 of them have mental health problems. Now, this is going to be a combination of maybe schizophrenia, which is a very small percentage, a lot of clinical depression, and then, of course, a lot of cognitive issues associated with different forms of dementia. And there are a bunch of different forms of dementia that we're going to talk about, okay? So that being said, what happens is older Americans and people in general completely underutilize mental health services, okay? There's access barriers, okay? One of the big access barriers is getting to find a psychiatrist. We don't have enough psychiatrists. There's a dearth of psychiatrists, okay? If you do find a psychiatrist, a majority of psychiatrists, the new culture of that profession is it's too hard to get reimbursed from the different types of health insurance, the healthcare plans. And so their fee for service is completely 100% out of pocket. It's not a copay, it's 100% out of pocket. And so there becomes a financial barrier to getting mental health services, okay? So, and then people, deny it, okay? And so we have this lack of professional services. We have the denial, okay? And it's got some issues with it. So when the fear, distress, anger, stress from mental health, okay, influences in a negative way your immune function, your vascular system, related to diabetes, okay, and you become very susceptible to infection, pain, and have lots and lots of different problems, okay? Social support and relaxation take it the other way, all right? All righty, so now, when we, again, look at the stats, and I'll go back to our website here, and we look at the stats, okay, about clinical depression. So this is right here, okay? So we look at the age of onset of clinical depression. When you go through puberty, there's a major rewiring of your brain. There is the beginning of independence, okay? The social strife of, becoming an adult, okay? And we see this big surge of the first reporting experience of clinical depression, so the age at onset, okay? And you see it happens, it's, between 10 and 15% for each of these age groups that you guys are basically in right now, okay? Either it's late teens and early 20s, all right? And then this may be something that you may have to fight the rest of your life, okay? It all has to do with the way the brain rewires and changes during this critical period of development, okay? Testosterone, estrogen, they all influence how this front part of our brain works, and you can combine that with some difficult times, okay, and then it's something that you have to deal with for the rest of your life. Now we see over here this older age group, okay. As a first-time onset is pretty small, okay? Less than 1% would be the first-time onset. But that being said, these people that experience depression will carry that depression with them through life. And so that's why when we look back at the American Psychological Association PDF file we're looking at, they're talking about 20 to 25% of people over 55, 65 suffer from depression, okay? That's a big deal. Now, the depression can be far worse because you have these outside influences that I was talking about, okay? You're having financial issues. You lost your job and you're 60 years old. What are you going to do, okay? You have physical limitations, okay? Like I said, you're an athlete and suddenly you're not, okay? You have mental health issues, okay? Maybe you have diabetes. All these different issues begin to grow and wear you down, okay? And so this becomes an outside influence that, move my picture out of the way here, and we look at suicide rates for men. Men are much more likely, and we'll look at that later on, than women. Comparing these two different time points, and you see it's pretty constant right here. And we see down here, okay, the rate per 100,000 people. This is a prevalence, okay. We say it's pretty low down here in the early teen era at the time. This is your age group, okay. If you're depressed, again, again, you look at this, you see it dramatically increases the likelihood, okay, when you get in here. So again, this is death by suicide per 100,000. We see that it almost triples, okay, by age group when we look over here at people that are older, okay, and it goes back to those kind of age-appropriate limitations that happen. You've lost your independence, you're not an athlete anymore, on and on and on. All right. We also see that it's very different amongst different cultural groups. Okay, and we look at American Indian. Okay, here, and we see this right here that they have a very large rate of suicide. All right, and a lot of cultural influences, a lot of problems in those communities. Right. Right. So we see white people have a high rate here. And we look in here, we're looking at male versus female. Testosterone is a driver, okay? Just testosterone creates a lot of anger, okay? And it really basically is a big influence for whether or not you have somebody committing suicide. So we look at male to female ratio, big difference right here, okay? Men tend to do much more violent acts for death, okay? And then we look, okay, again, it was much more likely, on a per population basis, we're looking at prevalence, if we're looking here at older people, all right? Awesome. Now we scroll down and look, you can identify your cultural group, whether it's Hispanic or Latinx, Black or African American people, Asian, Pacific Islanders down here. Okay. All right. Awesome. Okay, and this we'll get into later on. All right, so we'll go back to our PDF file and get back into it. Okay. So we see here again, like I said, even though the first time of onset of depression is smaller, people that have been depressed their whole life, then it accumulates, okay? And in these conditions right here, nursing home depression is much higher. 2/3 people have some mental health issues. 37% have clinical depression, okay? All righty. So, and even though older Americans in that age group of over 65 make up a smaller percentage, they make up a higher percentage suicide. And it goes back to what I was talking about these kind of outside influences and environmental that are much more likely to create a deeper depression and result in suicide. All right, so this is just some stats about Alzheimer's, okay? And I want you to kind of read through this. This is just to let you know, okay? We'll get into the nitty-gritty when we go into the Alzheimer's section of this week's assignment. We need more people specializing as psychologists, physicians in gerontological or geriatric issues. That's the bottom line. We don't have enough people. And the other thing that's really important is with the limited access to psychiatric care or psychological care, because of finances, okay, because of mobility issues, because of the stigma, what happens is you're much more likely than to self-medicate. That's true across all ages, okay, becomes really a big issue when we look at older people, okay, and we see that substance abuse and especially alcohol, because of its easy access, becomes a huge issue, okay? And the other thing is your kidney and liver don't process the alcohol as well, so people get hammered when they're drinking as they get older. So this goes through the issue with this. Self-medication is a big issue, and it's a huge issue in terms of older Americans, okay? We have these combination, these chronic diseases that I've talked about, okay, they both tap into the likelihood of having some type of behavioral problem, some type of clinical depression, okay? Alrighty, so we need more people to specialize in this, and that's what that's all about. So I'm going to get out of this right here, and I'm going to take you back up now to the next phase, okay? So that's part one, okay? And then part two, okay, is looking at a pretty significant mental health problem, okay? A major neurodegenerative disease of aging. It's progressive, meaning it gets worse and worse and worse and worse over time. And there is no cure for Alzheimer's disease, and so it becomes a significant burden, okay? Whether it's a spouse that's caring for somebody that has Alzheimer's, or if the baton is passed on to the next generation, maybe your parents or you, okay? And so it's a big deal. Within the reading quiz, we just kind of want you to kind of navigate the websites. You can watch these videos, this video right here about the underlying mechanism. It only taps into one part of it, and it's the pathological clumping of kind of degenerating neurons that happens. They call it plaques and tangles. A big issue, however, is the vascular part related to diabetes, and I want you to remember that, okay? There is a inherited risk, okay? 40% of people that get Alzheimer's. I said 80% have diabetes, 40% have this gene that if they are diabetic, the wheels come off the bus a lot more quickly, okay? And it's a gene that processes these proteins that serve as basically cargo ships in our blood for taking fats and cholesterol around, okay? And so it's called the ApoE gene, and Christian Pike, our very own Christian Pike from the Gerontology Center, is a world leader in this, as well as Tuck Finch, okay? And check that out if you want, okay? We don't have time to go through all that, but what I do want you to do, though, is check out these websites, and you can use them. You navigate, as I indicate right here, okay, about Alzheimer's. This was the APA, American Psychological Association website that we just went over, okay? And there's two different ways of doing it. This fact sheet is pretty easy, okay? So if we click on this guy right here, and so you can get through, basically everything is hyperlinked to different parts of this kind of reading right here. So as you're going through the quiz, or if you're doing it for your own edification, okay, you can learn about how it affects the brain, okay. Basically the bottom line when we look at Alzheimer's, that's how it affects the brain, okay. Massive degeneration, healthy brain, severe Alzheimer's disease, okay? And then you can ask yourself, why is this happening? And then this gets in right here, okay, to the pathology, okay, the plaques and tangles, but it also goes into the behavioral consequences. Signs and symptoms, we're going to go over that, okay? There's no blood test. There's only a psychological analysis where it takes a good hour where you sit there and you do memory tests, short-term memory tests, okay? Long-term memory tests. Does the person know what day it is? Do they know what day of the week is? Do they know how to get to places, okay? Can they navigate maps? Do they know the names of their children? Do they know the names of their grandchildren, okay? On and on and on. Word choices, things like that, sentence structure. And so the American Psychological Society put together a battery, an agreed upon battery called of questions called the mini mental status exam. And then the person who's super trained in terms of diagnosing dementia, they sit there and score somebody on a scale, okay? And depending on the person's score, then they're given a diagnosis of mild, moderate, or severe Alzheimer's disease, okay? Yes, you can you can do imaging tests, but most insurance is not going to cover that, okay? And you need pretty severe Alzheimer's disease to be able to pick up the shrinking of the brain, okay? All right, so again, this goes over some of the issues, okay? And you can click on the hypertext that happens. Personality issues, just basics of activities of daily living. Do they clean themselves? Can they pay bills? And then it comes down here, and then deeper memory loss, Paranoia, sadly, is a big one. And at the end of life, people are basically bedridden and kind of mute. They don't do much. But sadly, even though they're just a shell of who they used to be, their heart keeps going. Okay, and this is why we have this really extended life period. So they have memory care units, and assisted living facilities / nursing homes, Alzheimer's care units. Cost a lot of money. You're looking at 100 grand a year. Okay, and and not covered by insurance. Okay, so this is why it's pretty limiting in what we can do. All right. So here's the basics in the biology of Alzheimer's disease. That's the video that we actually have posted. This goes over the genetics. This is that protein I was talking about that carts around cholesterol and fats, triglycerides in our blood. Okay, and genetically, some are really put you at risk for getting vascular disease and associated Alzheimer's. It kind of is intertwined with diabetes. Okay, there's a couple other really rare ones. Okay, this is what we have under our control. All right. Control your blood pressure, okay? Control your risk for vascular disease, and you control your likelihood of getting Alzheimer's, all right? So we have social engagement, diet, activity. That's it, man. It's the easiest and it's the most difficult to maintain, okay? And then this goes through, how the diagnosis happens, okay? Um, you know, there's opportunity for clinical trials at the big major medical centers like USC Medical Center, Keck Medical School, UCI Medical Center, UC San Diego, whatever major city you're at. Okay, it's something worth thinking about because you get the concierge treatment. It's usually free. Okay, it's covered by drug companies and also by large grants from the federal government. So it's something worth considering if you're willing to participate in a clinical trial. Sadly, we don't have any new diseases. Okay, so this goes over how we treat it, and the drugs that are out there are they don't do really much of anything. They don't stop the progression. That's the bottom line. Okay, they barely tap into the symptoms, and it's controversial as to whether or not they are even worth using. So anyways, it is what it is. Okay, the big deal, okay, is you and your family and having support as a caregiver because if every single minute you're driving, they'll go take care of your parent or your grandparent, or you're actually doing some of the nursing care at home with your grandparent or grandparent, paying their bills, cooking for them. Those are times that you're not working. Okay, so there's the cost of doing that and the lost income for you. All right, so these are big issues. So to think about. All right. All right, so that's what that's all about. All right, I thought I would show you that link. The other one we go into, okay, it's a little bit more in depth, okay, same topics, okay, so we could look at treatment of Alzheimer's disease, for example. So I click right here, okay, and then you scroll down. They have, lots of newsworthy stuff that you can check out if you're into it. You go into the actual section that talks about treatment of Alzheimer's disease, okay, and here it is right here. How is Alzheimer's disease treated? And then you'll see down here, it goes into a lot more depth than the last time. All right, so here's the actual drugs that are being used. Okay, this was a new FDA approved drug, Food and Drug Administration. It's an infused antibody. It's supposed to take away those dying neuron pieces, the plaques and tangles. It's controversial as to whether it even works. Okay, and then these are the old school. They've been around for 30 years. These drugs, and again. Very controversial as to whether they work. All right. So, anyways, and this tells you about how they're delivered. So that gives you kind of a feeling of how to navigate this page right here. There are other dementias. Okay, you can click right here, and it talks about the different types of dementias that are out there. Alzheimer's is the most common one. It's got the most amount of notoriety. Frontotemporal dementia is a big. I had a friend who died of it in his early 50s. Yeah, it's different because it gets rid of it goes after your emotional part of your brain first, and you become very childlike and very difficult to handle. Lewy body dementia is kind of a hybrid between Parkinson's and Alzheimer's, and so again, it's frontal cortex, but you might have some movement problems. And then there's right here, as you can see, lots of other dementias that you can look into. All right, so that basically is how you navigate this website. And so now we're going to finish up by just kind of looking through. I want you guys, when we look at this guy right here, so these kind of facts and figures, okay, about Alzheimer's disease, okay. Again, every year they put out a new one of these. I mean, look at, again, the shock and awe of how many people are suffering from Alzheimer's disease and other forms of dementia. And then it goes over the cost, okay. Yeah, so and then down here is the basics of some of the biology, right? So we did this right here, okay? We did the depression, okay? And again, age being the biggest risk factor for dementia, okay? And we can see that, people that are in this age range right here, okay? So we're looking at 75 to 79, okay? So your part start approaching about 7 to 10%. You get up here into 30%. You see women are much more likely, and you see how it kicks into gear right here, okay? There's a whole loss of estrogen component to this. We have a bunch of figures that we highlighted here. This is the best source for the figures, right? So if you click on this website right here, okay, it takes you to the website that is about the facts and figures. All right, so it's a really well done. There's the video that I showed you right there, okay, and then it goes down here and you can go over and look at all the facts. Okay, here's shock and awe of how many people, 6 million people by 2050. 1 in 3 senior dies with Alzheimer's. Okay, we had a dramatic increase in death from Alzheimer's because we just couldn't care for our older adults during COVID. Okay, it was really sad times. True of a lot of diseases, cancer rates went up, etc. We see how much money it costs us. Okay, so look at dementia. It costs our country this year $321 billion. Okay, cost of care, cost of on society, cost because you're not working. All right, so that's all rolled into the economics of that. We see by 2050 it'll be $1 trillion. Okay, so I wish we could do better in terms of this. Okay, and then this goes over, again, the cost to people. Okay, 11 million people. Okay, are doing care for their parent or grandparent, and it's not paid. Okay, so it's a negative on your personal business, your personal economics. Okay, and again, this is looking at the billions of dollars that valued in care that you're not paid for. So you can check it out right here, and then what we did is we kind of highlighted some of the biggies right here, and go back to my browser. All right, and again, this is kind of shock and awe what's going on. All right, so we look at again the number of older people projected to have Alzheimer's disease by 2050, 13 million people. Okay, this goes through some of the numbers right here that you can tap into, look up, read. I'm not going to read it for you. Okay, we see when we look at equity and diversity, what we see is inequities across the board. In terms of getting care and help, okay, and we see here the barrier to Alzheimer's care, okay. These populations reported having major discrimination when seeking health care, okay. Black Americans, Native Americans, Asian Americans, okay, and the Latinx or Hispanic community, okay. This is again 1 in 3 seniors, like we said earlier, okay. 6 million Americans living with this. Big increase because of COVID, okay? The amount of people that are doing caregiving, okay, that are not being paid, and the cost, okay, of just not being paid for the care, $257 billion. So again, look at all these numbers and the future costs to our country. If current costs, $355 billion, future costs, trillions of dollars. So this is, why it's such a big deal, okay? This is, we look at, this is kind of the normal age-related changes in my brain, okay? Sometimes I make bad decisions. I've done it my whole life, okay? Sometimes I forget to do a payment on something, okay? So you got to automate it in the computer, baby. Have reminders on your apps, things like that, okay? Forgetting which day it is, not so much, okay? Yes, I'm grasping for words all the time, okay? Losing things from time to time, yes, right? Life gets complicated, but you see it all gets snowballed and accelerated and grows and gets more progressive when looking at dementia. So that's, use that as a cheat sheet. Okay, so this reiterates the cost, okay? And then when you look at the cost, this is kind of like I said, your first exposure to the kind of the issues that are caregiving. And so we look over here, okay? And people that doing caregiving, over a third have major interference with their activities at work because they're dealing with their parent or grandparent that's got these issues. 14% when this publication was put together had to quit their jobs, okay? 42% are this sole caregiver, okay? And this is kind of mind-blowing. The average age of the caregiver, and this was studied on millennials, is 27 years of age. So you've got your own kids, maybe, your first really good job, and now you're dealing with this, okay? So when we look at these caregivers, their majority are in frequent, constant communication with healthcare providers for their parent or grandparent. Okay, a lot more than 50% are actually doing nursing tasks, and so this is why you get into this part over here where it's interfering with your work. Okay, you guys read through the rest of this. Okay, I want you then to come down here. This is for your discussion. Watch these quick videos. This is what it looks like to have an Alzheimer's parent, okay? And this shows you a spouse caring for their Alzheimer's spouse, and then this is an Alzheimer's parent, how significant and severe it is, and then you got to come up with something as a plan, okay? If any of you are your parents are experiencing issues with caregiving, in the LA area, at our gerontology center, the Leonard Davis School, we have a caregiver support center that have caseworkers that will provide you with direction in terms of services and assistance so you don't have to do it alone. We have the same thing down here at UC Irvine. They have it at almost all the medical centers, the major medical centers around the country. So don't do it alone, seek help, okay? Alrighty, guys. Well, that's it. Kind of long-winded, important topic. And what we'll do is we'll see you guys next time. Fight on.